I have a question about Hillsborough County's fee schedule. And it said it was last updated in 2015. They had a consultant who helped them perform the study. Are they looking, or do you know if they're looking to change that?
And I'm sorry, ma'am, they are currently using a consultant to update their schedule, so that's in progress. That's not something old, that's something that's going on currently.
Okay, and do you know what they're looking at doing?
I do not.
Do not, okay. And the reason why I asked that is because, I know we're trying to definitely make sure that we recoup our expenses here, but, we're taxing, and overall, everything should be fair and equitable. And, there's a saying, the rich get richer and the poor get poor, and when you look at it, it's so not fair that, the more money you have, it seems like the cheaper things are for you. And the poorer you are, the more expensive things are for you. When you're poor, you don't get discounts, but when you're rich, you do. Although you have more money to be able to pay for the full price. And looking at this, it seems like that may be what's happening here. Because the larger buildings, they have a cap, so they're not paying their full, the full cost. But when you're looking at the smaller buildings, they're not getting any discounts like the larger buildings are. The cap is actually creating a discount for these larger buildings, where the smaller buildings, they're not capped at anything. They're paying the full price, And so when I looked at Hillsborough County's fee schedule, it looked like it was more fair. I like the way they have the cost is per additional 1,000 square feet, which to me, that makes it fair across the board for everyone rather than having a cap. And so is there a reason why we're not looking at that format?
State statute won't allow us to do that. We have to charge what our actual expenditures are. And in the example I gave you, it would not cost $11,000 for us to inspect a building that size. It takes time, and there's a multi-day process, and certainly, but it would not be right, and we would actually be a violation of state law. Mm-hmm. Our smallest businesses are being, the true mom and pop, if you will, small businesses. We're visiting them once every 3 years, $87 base fee, and if they're a small 2,000 square feet and under, that's a $29 annual fee amortized out. I know every dollar counts when you're on your own business, but I think we're trying to keep it as reasonable as possible for those smaller businesses.
Okay, so you're saying that Hillsborough County's then they're going to have to redo it because it's not following state statutes?
If they don't have a cap on their fee, yes, they would have to. And I don't have their fee schedule in front of me, but they would have to meet state statutes somehow, just like we do.
Okay, is there a way to make it more fair and equitable, though, rather than using a cap and spreading the cost more evenly? Based on the size of the buildings, though.
We've used a consultant to do that. That's what we're presenting to you. That was what the consultant, and looking into our expenditures, what would be required, that is what was recommended.
Were there alternative ideas?
I don't know, ma'am. I wasn't part of that part of the consultant.
Is that your consultant right there?
Oh, here she is.
Good morning, Negan Camp with Banish. So the user fee is supposed to be proportional to the actual effort. It's not like taxes which are proportional to the value and therefore the wealth of especially the property taxes, wealth of the person. This is supposed to be for the effort. So when we started the study, the first thing we did is back solve how many hours different fee levels imply under the existing structure. So with, for example, $11,000, I think it was about 135 hours, and the fire department didn't feel like they spent that kind of time on that. So that's why the cap is, to kind of reflect their full burden on the department, but not necessarily, but again, reflecting the time that the department had to spend.
Okay, why aren't we looking at it as time then rather than square footage?
It is time averaged over buildings. So it's difficult. It's difficult for them to physically charge every building separately as far as administrative part of it. So they have to come up with the average cost. So on average, we are saying, this range of buildings are likely to take this long, a small building is just $87, less than the, doesn't even trigger the variable cost. So I think that's trying to come to that average. And over time, it can be supported and refined as they observe once they build their full budget and schedule and track their, maybe some time and so on, they can refine it further.
So if I can have an example like this 1,900 square foot building, how much time does it take for that one compared to the, what is the hotel, the 548,000? I would like to hear what the cost per hour is, or whatever you want to use there.
So cost per hour, we looked at their salaries, so it was about $38 per inspection, per hour. And as far as so what, if it's a small building, there's still a minimum amount of work and time that needs to be spent to do the inspection. But then as the buildings get bigger, as they explained, there's more spots to check and so on, so that increases.
We also have the burden rate as well. So there's $38 per hour plus the burden rate, I presume, is in that as well. Some administrative costs associated with that.
I think that was incorporated. Is that
Yes,
correct?
and this is pretty standard, Commissioner Bonilla. This is our standard process for a number of our fees. And again, it is just cumbersome to try to do it on a per unit basis. And much like with other fees, our inspection fees, it's the same. We review them on a periodic basis. We update them. If we see the time is less, we actually have to adjust downward. If we see the time on average is higher, we come back. And this is, again, the standard approach on all of our fee-based, inspection-based type of services. And we do come back periodically and make those adjustments to the inspection rate based upon our calculations over the couple of years of experience.
Okay, so this is not like set in stone, this is just a trial, and then we'll come back and see how it's working out?
With all of our inspection fees, we come back, like with the building, earlier we were talking about building speed inspection. We do that. We periodically update all of our inspection fees to ensure we're covering the cost correctly, up or down.
Yeah, I just might want to make sure that it's fair and equitable across the board, and the smaller buildings aren't paying more to subsidize the larger buildings, sort of thing. So when will this come back again?
Actually, fire department just started a more comprehensive fee update that includes all their fees, and they would like to relook at this fee as part of that process. And during that time, and correct me please if I'm not saying this correctly, but during that time also they will start hiring, and they'll have a better idea of the full budget and the type of effort it's taking. So I would expect over the next year or so, when the full fee comes, you'll see some preliminary results of this fee as well, how it's working.
Okay, all right, thank you.
Correct, yes.
Well, there's definitely been a lot said, and, I really want to say thank you, for all the work that all of you have done, and, just all the key focus areas, we're looking at expanding access, right? We're looking at early intervention, we're looking at education and awareness, and we're looking at building collaboration with our community partners. All of it's in here, all the things that we should be doing.
Absolutely.
And, we're providing that commitment, the resources, the money to be able to move on these areas. And then we have, homelessness too, which is also covered in here. And I've said the story before, and I just will never forget, that person who said, people, when they become homeless, that's when they're facing trauma and different things. Mm-hmm. And, they have, behavioral, mental issues from being homeless. Like, it's not always that homelessness is a cause of mental illness. It's homelessness is causing mental illness. So, that those numbers that you had brought up too, where $100 increase in rents is a 9% increase in homelessness. is just, it's insane. It's a lot. And, you know, I'm definitely hoping to one day get the number of like how many units they actually need to bring that down, and get that number at some point, which might be difficult, I understand. But, you know, just have a couple of questions that I know I've been talking with some of the community partners, and, you know, I've had long, 1-hour meetings with them just talking about the problems, coming up with solutions. And one of them's in here about the assisted living with supportive services for those with mental illness. And I see that there's some units that are mentioned here. Are these units for just anyone with low income, or is it specific to those with mental illness?
I think, Commissioner, I think those are low-income, extremely low-income set-asides that Mitchell is doing in these developments. And those are often people with disabilities. They're often people who are suffering from homelessness. So could be either.
Okay. And I see that one of them has the supportive services.
Yeah.
That's the one with the 45 units?
Yeah, I think that's part of the new HUD.
Yes.
Yes.
Yes, that's
They
what it
will.
was.
Yeah, those would be with supportive services, yes.
Okay. And, I did try to do search, and I did see that there was a facility in Seminole County, and I think there's one in Orlando or Orange County as well. So I was just wondering if there are any other partners who are looking to build some of these facilities?
I'm not aware right now, Commissioner. I know the Orlando Health is the largest psychiatric facility being built. I don't know what the timeline is on that yet. It's very new. We just got that number, I think, last week from them. So it's very new. I don't know if anybody else is building psychiatric facilities or building out capacity, but that certainly is one of the problems and the issues, right? If you're going to expand services across, you need facilities by which to do that, in which to do that. So we need to be thinking about that as we work to expand, services, that we're going to need the capacity and buildings to do that.
Okay. Yeah, some of the discussion was that just some people just need that support, assisted living, because they won't stay on their medications themselves without that
Absolutely.
support.
So many people. And it's kind of what I said. I thought if you look at some of the people that have real high acuity behavioral health issues, back in the early 60s, even early 70s in Florida, I mean, Chattahoochee was still open as a general commitment facility in the early 70s. And there are some people that just, no matter what, whether it's long-acting injectables or whatever, they can never be really stable. It's a very small percentage, but a lot of those people, if we were back in the day, they would be institutionalized because there weren't any facilities that could take care of them. And kind of create a secure environment, give them their medication, and take care of their daily needs, or help them take care of their daily needs. And a lot of these folks need that. I mean, you see them downtown. You see them in your jurisdiction, in your district. And those are people that are very, very sick.
Yeah. And I'm just wondering, so I know, and I mentioned this program before in Dallas, Texas, how they had that, I think it was called Unlocking Doors, nonprofit that when someone's released from prison or jail, they get those names and they provide case management for their entire life, and they make sure they get with them once they're released. They help set up appointments, make sure they get to their appointments and everything for whatever they need, because there are some individuals who, depending on how long they've been in jail or prison, they don't know how to function out in the real world. And, I've read stories from people like, someone, he was arrested at, I think, somewhere between 16 and 18 years old, was like in jail for 15 years, and came out and did not know how to function at all, was afraid to go to Walmart, like just all the noise, and it was just a lot, so just needed to learn how to get themselves, well, I can't even say get themselves back into life because they didn't have a life.
Right.
Like, didn't know how to do grocery shopping or cook or at that age, you really didn't start your life yet. So, organizations like Unlocking Doors help people to, if they need to learn how to use a can opener, which was an example they actually gave me, like they provide that help and support to those individuals. And it helps with them not going back into jail, because like some of these stories I did hear from these people, they were like, I want to go back because I felt safer, they were what you call institutionalized. So, definitely that support is needed too.
Great.
And I did have a question. So I know you were mentioning that mental illness should be considered like where our doctors are thinking about that, covering it like it's part of our medical records. Is it like, because I know I could be wrong, but I thought we had digital medical records that any doctor that we go to can access.
Well, mental health information is very protected. Substance abuse and mental health. There's a federal code, 42 CFR, that protects confidentiality. There's state laws and regulations. There's HIPAA. So all of that information is very well protected. So there's not an interoperability to where physicians share information. Like my physician can't go into my behavioral health portal and see what my community mental health psychiatrist prescribed for me or my diagnosis or anything like that. There's no sharing of that information. As we move towards more collaborative care, like psychiatrists and mental health professionals and substance abuse professionals all working in a practice together. So all of that information is in that practice. Is there an opportunity to be treated for your stubbed toe at the same time you're getting your psychiatric medication re-prescribed? That is the perfect world. You should treat the whole person, mind, body, spirit, in one location. And that's kind of what we're working towards with putting therapists in primary care, access network clinics, pre-K clinics, community centers that maybe can start to, I don't know if we have like 50 clinics that are, all integrated with all those disciplines, then start referring to those that need that help. 20 to 25% of us will have a diagnosable mental health disorder in our lifetime.
They
And
say
so,
1 in 4. So 1, 2, 3, 4, 5, 6, 7, 8. So it's a
I'm
couple
looking at
of
you,
us
Mayor. Not to stigmatize it anyway, but, in talking about, the stigma, we had mentioned the LGBTQ community and minorities. I'll tell you, as a minority, it's already difficult to function in our world. We're already being judged, Sometimes I feel like I can't even open my mouth. It's like you're always feeling like attacked, And so when you put on top of that, you want to talk about, I may have a mental illness. I mean, come on,
No,
do you
okay.
want to give people more reasons to treat you differently? So that's probably why it's so difficult.
and that's
why
part of
there's
why
that stigma.
we need this anti-stigma campaign.
Yeah.
Is to put, minorities in a voice about their experience, and to say, it's okay not to be okay, even if you're a brown person, whomever, it's okay.
Or even a woman, it's like, it must be that time of month. I just saw at a assisted living thing, a place for mom. Is that what it was called? And I was like, oh, geez, I know they probably meant like a place for mom to get help, woman mental illness, but a place for mom kind of also felt like, like back in the 50s, women, if the men disagreed with the woman, they would send them into a sanitarium. So, that's what it was back in the 50s.
I hate to do this, Donna, but we still have one more presentation.
Yeah.
So let's try to wrap
So,
this up.
that stigma and, we just have to treat everybody with respect.
Understood.
Yeah, thank you. So I just had a question because I knew something was coming when we had a quarterly meeting, but I didn't get a meeting or the proposal or any documentation until I saw the agenda book, and I didn't see it in the agenda book, so I asked for it. I'm going to get with my staff to reach out to all the administrative assistants to see if they all know how to make an appointment with my office, because I didn't receive anything to make an appointment for this, and I just want to make sure that if there's any issues or, in the process, that I get that cleared up so that this doesn't happen again.
Sure, we'd love to do that because we reached out and some able to accommodate us 2-3 weeks in advance because we want to get out early.
And I have room on my calendar.
Yeah,
'cause
unfortunately, we weren't able to
block
get
it
with
just
you.
for staff.
Yeah, we never were able to get an appointment until yesterday, so we'll be glad to find out what can be done to try to address that earlier when appointments were made with everybody else.
Yes, because I make it very easy. I have a link, you just go there, and I block off time just for staff for the briefing. So I have time on my calendar. I just have to figure out where things are going wrong and make sure we get that fixed.
Okay.
So I didn't have a chance to go through any of these projects or provide any feedback, except for yesterday when we had our meeting.
Right.
And I just have to say, I'm just a little concerned because, right before our meeting, I had a meeting with Raymond and with Joe Kunkel about pedestrian safety for the children who are going to school in Bithlo. And I've actually been trying to work with staff since 2020 on this issue. And I just kept getting that I had to go do the research to find all the bus stops. And eventually, I just kept asking for assistance, for help. And, then I was like, okay, I'm going to bring it to the board. And they were like, oh, we'll do the research. And I was like, okay, finally I'm getting someplace. But the meeting right before yours was on that. And I was told there was no funding for sidewalks or for, lighting. And then I find out the next meeting with you that there is funding happening. So if I just don't understand, I'm talking, but I don't feel like I'm being heard about what the issues are in my district. And, because if I was being heard, that would have been one of the projects I believe in here, unless there was some criteria that.
We had so as we discussed yesterday, we worked from the criteria that were established coming out of the Transportation Sales Tax Initiative. That was the document. That was the work that was presented to the board over a year or so ago. That criteria that was established there, we didn't see a need to recreate the wheel, and so we used that, and that's what we started from. That was the project. We didn't have a funding source. If the board ultimately doesn't support this, we still won't have an additional funding source. So the street lighting program is essentially over. As Raymond noted, we're just about out. The sidewalk program that we have, there's a certain amount of sidewalk programs we do, but this is for an enhancements of it. And so this was the basis of it. But as I mentioned as well, this is the opportunity, and that's why we, wanted to get in early where we can with the commissioners, and as we told each one of them, give us your comments. Some gave us their comments. Some sent us their notes and said, hey, look, I know my neighborhood. Hey, can we move instead of this sidewalk? Can we move it there? That was open solicitation, open request, and some gave us comments that day. Some have since sent them, and as I mentioned to you, this isn't over. So over the next several weeks, we still want to get your comments and from that list that Raymond provided to say, hey, look, and you gave some immediate items that you noted where you said, hey, in my community, we don't want streetlights here. Can we look at it over here? And as I said, that's what we want to hear. That's what we want to get back.
Yeah.
So that's where we are in this process today. That's where we've been over the last couple of weeks and in terms of engaging the commissioners early on. And again, that is the open offer that we extended and continue to extend over the next several weeks.
Okay, and so I did mention to you about the street lighting in the rural area and how, I mean, people are, always about light pollution. They move out to rural area to be able to see the stars, and if you put these lights out there, that's, to them, it's considered light pollution. And I see it from, when you're flying an airplane at night, you can see all those lights lit up. I do have a question about the lights, and I'm sorry, I have not noticed, but are they motion detected? Where they turn on if there's motion, or they just turn on by the time of day, or if it gets dark? Because I know where I've lived before, the lights were on a motion detector, where if cars were coming, then the lights would turn on, and they'd turn off when there weren't cars.
Commissioner, these lights, they are not motion detected. They just turn on, when it's, they sense the darkness and they turn on. They are mainly LED lights. That's what both Duke and OEC are transitioning to. And with respect to the Bithlo sidewalks, we took a look at it yesterday, and the sidewalks that we identified were about 16 miles of sidewalk in that area. And that's about nearly $47 million. So that is way in excess of end funding that we have. And our current sidewalk program.
Well, I was just asking for sidewalks where the bus stops were.
Right, and that's what we looked at, and we looked at connectivity and, to make sure that students could, connect and go to school.
Well, right now they're walking in the street.
Right. And also, when we looked at it as well, we have to do a significant level of design to address drainage and any other issues. So those sidewalks are probably 10 times more expensive than, a normal sidewalk that you just lay down, without any kind of design. It's probably about $600 per linear foot, and a regular sidewalk is only about $60 per foot. So it's a issue of, constraints of funding, lack of funding, because we only have about $3 million, $3.2 million per year for the entire county for a sidewalk program.
Okay. Well, when we go through the list of projects, we'll see what we can do.
Certainly. Yeah, I'll work with you on that.
All right.
Okay.
And then I had a question about the $15 million for the bus stops and shelters. I just want to make sure I'm understanding what that means exactly, because it says bus stops and shelters. Do you mean shelters at bus stops, or do you mean like additional bus stops on the routes, or both? Like,
currently, we have 4,200 bus stops around the region currently. About 1,800 of those reside within Orange County. Of those, we have sheltered and just, the blade that stands up regular.
The sign.
Blade on the sidewalk, right? The bus stop would include a pad, the actual shelter itself, seating, trash receptacles, and so on. So in this program, what we would do is, if you all would agree to put it into the program, our shelter program would look at all the different needs for each one of the segments. So they could be new, they could be enhancing an existing site.
New bus
Stop.
stopping, or like an additional stop to
It
the
could be another
route,
bus stop,
or-
yes. Could
okay.
be a new bus stop because, as you all have articulated many times, this county is growing dramatically. So we keep looking on how people are using the bus system all the time. And then, as you all do, you call us and say, we need a bus stop here, we'd like to move this one from there. We make those edits and changes all the time based on a service guideline. So it's based on ridership, and then sometimes the county's land use and right-of-way requirements, as well as some of your municipalities within the county. So our shelter team basically takes all of that together and says, what type of bus stop can be here? What kind of shelter should be here? How's the ridership there? So the short answer to your question, it can be both. It could be a new one or an existing one that's enhanced.
Mm-hmm.
But it's based on a criteria that says how many people are going to be standing there and why are they there, so that we can make sure that they're safe, out of the weather, and have a place to stand and wait for the bus.
Okay, are we looking at where, I don't know if that's included in here too, looking at where some of them are located so that we don't have mid-crossings
Yeah,
or mid-intersection crossings, you know, where there's an intersection here, and then there's a bus stop in the middle of the block, and that everyone's trying to cross there, and it makes it more dangerous.
Yes, ma'am. So in part of that service guideline tells us how the distance between stops for the type of service we're putting there. And then we work with the county to make sure that that's the safest stop we can provide. And then, you know, as you saw in the transit or the transportation initiative, there were things like mid-block crossings and those kind of things. Those are not currently in this plan, but we'll keep communicating on where those stops should be so that we make sure that people are safe and have a reliable service.
Okay, so if I understand that correctly, so this doesn't include looking at where they are and moving them?
It does. It'll be
Okay.
based on that service requirement. So we'll look at those bus stops in that corridor based on the 20-year plan, based on census information, based on your input and others, and say, okay, where's the right place for these bus stops? And then the question is, how many riders are on it? So does it require a actual shelter because a lot of people are standing there, they need shelter and rain, or is it one person every day that might use that stop? You know, so on. So we try to make sure that we get the right amenity there to help all the constituents and use the county's money appropriately.
Okay, and then my other question with the bus shelters is that how can we best utilize these funds? Because if we have faster service, so people aren't really waiting at the stop, and if we have the app that tells people where the bus is so that they go out right before the bus comes, would that bring down the need for the shelter? And then also, there's a lot of grants out there that I have seen for bus shelters, so I'm just wondering if we could just utilize more grants and probably, like, I don't know what the impact would be if we move some of these funds to the enhanced operational frequency, so to get more faster pickup times.
Thank you, Commissioner. Yeah, so just as Curtis talked about a little bit earlier, the funds we have available for capital allow us to match it with the federal and state side of the equation through grants and other block funding and other sources. On the operations side, that's local money. So we can't move the money from the shelter program over into service. It'd be nice, but we can't.
Yeah.
That money is intended to create a capital asset that depreciates over time and we maintain it and so on. The other money, that's what's neat about this program is we're able to actually provide that service enhancement. So the thing you all told us and the community told us, more buses more frequently. But to your question, what we're trying to do is build a program that puts the right bus stops in the right places. And we'd be working with all of you as well as those criteria to say, okay, is this the right bus stop in the right place?
Okay, and how are we doing with the app? Is that becoming more efficient to move people a little bit faster?
You got it. So we have a couple different things there. So we're just in the process this year of updating. We currently have a Where's My Bus application. It's Bus Tracker. So someone can go on a mobile application and see all the buses in the network. We're enhancing that later this year with a new Where's My Bus that also integrates the fare payment into the same app. Because right now our passengers have to use one app for the fare payment and one app for the Where's My Bus. So that'll bring those two together. Then the second piece would be we've also made sure that, and the Links Board has approved us to actually publish all of our transit information in standard forms. So last year and the year before during COVID, our team worked diligently to start publishing that. So if you go into Apple Maps, Google Maps, other applications like Transit App or Move It, Waze, our transit information is published out there so you can see all the transit routes, you can see where the bus is, and the idea there is it's public information. Meet passengers where they are, let them use whatever application they want and see where the bus is, and then maybe they'll pick that versus hopping in their car or doing another service.
So does Google Maps or any of those other apps track where it is, or is it just based on this bus schedule?
So right now, it has the actual where it is, so the route map in it. And it has some applications, like Google Maps, you can go, it's not as easy as our bus tracker, but you can go in there and see when's the next bus, which is the real-time information. And they show that. So if you know the route you're on, you can see when the next bus is. That's based on our team. We publish that information every 3 seconds, believe it or not, out into the world, so that they can take it in and ingest it and say, okay, this is where that bus is.
So it's live, like, almost like GPS.
Almost like, yeah. So every 3 seconds, it pops it out there and says, this is where I'm at, this is where I'm at.
All right, last question, does it actually use GPS, or is it just kind of
Yeah,
like?
GPS.
Okay, all right.
So all the buses have GPS on them, so we know where every bus is.
Okay, good to know.
Yes,
All
ma'am.
right, thank you. Yes, so when we had the transmittal hearing for the Vision 2050, my understanding was that when we came back, there would be amendments based on some of the town halls that we had and feedback from the commissioners. But now I'm confused because I'm hearing that there won't be any amendments made to it. So I'm wondering, like, what's the process going to be then for us to get amendments in it, and what do those dates look like? Because I thought it was supposed to come back in July with amendments and something in a format that we're all happy with. So if no amendments are going to happen, I'm just, before July, at the July meeting, I'm confused with what the process is going to be.
They all have that perplexed look on their face.
Commissioner, when you made the comment that you're not sure it's coming back with amendments, certainly, I mean, we haven't had the internal discussions yet about how it's going to be represented back to the board. I know that Alberta's been really engaged with all of your offices regarding those public community meetings. We still have to synthesize down what we've heard at those meetings, and of course, the feedback from your offices specifically as well, and how that's going to get presented in the context of the plan that you saw previously, and opportunities for amendments that ultimately you may want to direct staff as part of that transmittal package to ultimately adopt. So we haven't had those discussions in terms of what's going to get presented back at the hearing. Again, as we've looked to that feedback from those community meetings, that's where we're going to wrap in and figure out ultimately how we're going to present and synthesize that down for you to digest and then give direction to staff.
Okay, so I was told by both Alberto and Byron that we wouldn't, that it was going to come back, but with no amendments, because you need to hear from the board direction of what is going to happen. So I'm just confused that I want to know what that process is going to look
Okay.
like.
So the conversation you and I had was before there was any discussion about going back out, and you were asking me about, and you were asking me, why didn't they make these changes I asked for?
No.
Yeah, I have not had a conversation with you post the board meeting to go back out and do more community engagement. The conversation we had was, why didn't they make those, what changes be made when we had that first? And I said, Alberto's going to make the presentation. He wasn't going to make the changes then. He'll present what was, this was the back at the first transmittal hearing.
No, this
I said
was
he was going to
after.
present, and the board can then, in fact, what I told you is some of the items, for example, that you said we ought to change, I said, we don't know if the majority of the board members feel that same way. So on some of those items, some of those items, but the responsibility is to present those, to say, here's what we heard. And if the majority of the board says, let's make that change, then of course, staff will do that. That's our responsibility, to be responsive. But on some of those areas that were broader policy areas, it would not be our appropriate for staff just to simply make a change based upon one voice on something that has countywide implications versus if it was in your district.
So let's do this, because that's an offline conversation.
Yeah.
The short answer to your question, though, Commissioner, absolutely, there'll be some modifications made.
And I'd like to thank the new resident who said that's her first time coming. Thank you for coming and for providing your testimony. It's very important that you stay engaged. So whatever happens, don't let this discourage you from continuing to come. I want you to. The gentleman sitting to your left has come many times. We've seen each other in community meetings and everything. He's very engaged, and I thank him for that as well. The history of the area is the quadrangle. It's supposed to have, a research kind of park. It has a lot of entitlements for all of that already, office space. It's right across the street from UCF. So it's a prime location for student housing. However, we do have this single-family development in that corner on the opposite end of where UCF is. And they have said over the years that they only want office next to them, which is what was already approved there. So I have denied previous student housing that abuts up to their subdivision, and because they wanted office. Now, after that, came other student housing projects within the quadrangle that was not abutting them, and I went ahead and supported those for approval. With the residents who did state, against those, that they didn't want student housing, that there was going to be traffic. And I was like, look, you only told me you didn't want, student housing abutting your subdivision. This is not abutting your subdivision. The office is still abutting your subdivision. That's what you wanted. That's what, I agreed to with you. And so I did have a traffic study done that showed that their concerns about traffic going on up north on Rouse and then right or east on McCulloch wasn't going to happen because there's other roads within the quadrangle that's directing the traffic the other way. And then we also have the UCF shuttle, which would also take cars off the road, and it's so close that they can bike to UCF if they wanted to. So there's a lot of benefits, and I've told them this, to the area and to them to have this student housing nearby to take traffic off the roads, which they were complaining about. They've also complained that within their subdivision they were having crime due to the students who are already living there and crime in the cemetery across the street, the Rouse Cemetery. I talked to the sheriff's office. They actually told me that they're not seeing that. They haven't received calls or reports of that. So, if they have something, they need to report it so that it's in the records. But there wasn't anything being reported. So, that wasn't a concern. If there is racing going on, I'll talk to Seminole County about that and see what we could do because, I'm working with them on some other traffic issues there in McCulloch as well. But back to the student housing. So they still have office next to them, which is what they wanted. That office building, if it comes in, could be 6 stories tall. That's what they wanted. So this being, it's going to, actually that office building that they wanted is going to block their view from this student housing. So I just don't see how it could be an issue when they wanted that 6-story office space next to them. So I'm going to go ahead and make a motion to approve. I'll start with saying that I feel validated. Don't you feel validated, having the data here to back up what we've been saying? And in 2017, there was this development here that on, I don't know, what slide is, 20, I guess. Yeah, slide 20, it's all red and stuff. And, that development there, they had their entitlements because they were part of the rural settlement to develop there. And I had negotiated with the developer to put an advanced treatment septic tanks, and that got passed. Well, then a couple of weeks later, it came back to the board, and it was Mayor Jacobs at the time, and I guess they were told that we can't request that they did that. And they just reversed that thing, and now here they are, right here in red, where I wanted to have advanced septic tanks, and they've reversed what I had done, because they said we couldn't do that and require them to do it. And now what? The county has to pay for it to change it, or someone has to? Well, I'm sure we're not going to pay for it, but now it's like if it was just done back then, this wouldn't. At least we wouldn't be worrying about this subdivision. So I feel validated. A little too late, but I mean, we've been saying it. And I would just have to say, it feels good to at least have some data, though, to show that, we're, us intelligent women up here were right. And we've been saying it. And to have this data is just so awesome. It really is. It feels good.
I don't know if that's a knock on the men, but
Well, it's the
like-
women here who are on the board. That's what I'm saying.
you
Like
invoke-
we've been.
you
like,
invoked Mayor Jacobs' name into that conversation and everything.
Well, she was. Hey, she
I
was
don't
the one
know how
sitting here. No, I don't mean that. Well,
No, man.
I am. I'll try not get caught up in that one. I didn't not mean her though. I meant us who came later, who started. Kept saying, like we have issues with these septic tanks. We need to do something about it. But you know what? I'll throw in a gentleman here. Thank you, Mayor, for being a leader and helping to push this forward too. Thank you.